This week at the Rangiora Vet Centre, Jazzy is getting treated for kidney disease, and we find out what symptoms to watch out for in your cat.
I'm Rebecca and I'm one of the vets from RVC, and today we're going to talk about pets who drink a lot of water, and specifically Jazzy here, who is an older cat who's recently been diagnosed a couple of days ago with some kidney disease. So it's a really common presentation from a client to bring in a pet when they're concerned that their dog or cat is drinking a little bit more, and it's certainly something that we're always on the watch for. We'll ask it often as a question in an older animal in a routine checkup, how much water they're drinking. It can be a sign of a lot of different diseases. The big two that we are concerned about are kidney disease and diabetes, but there are certainly some other more weird and wonderful ones. There's a disease called Cushing's disease in dogs too, which is quite common. Fortunately, we hardly ever see that in cats. So Jazzy was one of these patients. Her mum had noticed that she was drinking a lot more. She wasn't eating as well as she normally did. Her appetite was reduced. And she was vomiting every couple of days, every 2 or 3 days, and there's certainly a lot of cats out there who vomit every now and then. But a change in that is always something to be concerned about. If you've got a cat that really hasn't been a vomity cat and all of a sudden they're vomiting every couple of days, and particularly in association with the drinking lots and the weight loss and the change in appetite, it's definitely a good reason to bring them in and have them checked. So this is what we'd noticed with Jazzy. She came in on Monday feeling pretty sad, not really feeling like lots of cuddles and smooches like she normally does. And she had lost a little bit of weight. You can see she's still, for an old lady, she's still in pretty good condition. But she had lost weight and really not that into her food. So we took some blood and some urine from her and tested it. We were looking to see whether kidney disease or diabetes could be what was going on with her. And her blood test gave us a pretty clear result that her kidneys weren't doing well. These are her blood tests here. Her blood urea and her blood creatinine were both very, very high, which is what we see in most patients with kidney disease. And also her urine was quite watery. It's really, really common for older cats to develop kidney issues where their kidneys just aren't doing their job as well as they should do. We're lucky now, we've got lots of really good treatment options if we pick them up early enough. There's an awful lot we can do to help them feel better for a longer period of time. Jazzy's been on medication for her kidney disease now just for 3 days. We're not going to be able to cure her, but we've certainly made her feel heaps better. She's not vomiting anymore. She's at home now. She's just come back for a recheck today, but at home she's eating really well, and she's much happier. She's following her family around again and smooching everybody and generally feeling like a much more catty cat, aren't you? Hey? Not swearing at us as much as you were either, which is good. So upshot is, if you've got a pet who you think is drinking more, bring them in to see us earlier rather than later. If we catch them early and we can get that diagnosis pinned down with blood tests, then hopefully we can make them feel an awful lot better for a good long period of time. Hey.
Next week, we meet 5-month-old Taku and get some advice on bringing a new kitten into your family.